Welcome, and thank you for participating in the 12th Annual Interprofessional Spring Symposium. This video addresses the question, how are patients affected by the ACA?
I think a lot of people feel healthcare has really become pretty much a business in the United States. And if I were a student, that would concern me, because really the reason most of us went in to be a healthcare professional is because we want to care for people. I think that's the promise of the Affordable Care Act, is there are a number of opportunities in the law that refocus us back on what ought to be at the center of every decision, and that's doing the right thing for patients. That ought to be a hopeful message, and students will be the prime drivers of saying, this works to that end, or this doesn't work, so let's change it.
The Triple AIM is a framework developed by the Institute for Healthcare Improvement that describes an approach to optimizing health system performance. The three dimensions of the Triple AIM are improving the patient experience of care, including quality and satisfaction, improving the health of populations, which the ACA seeks to do through improved access, and reducing the per capita cost of health care.
The Affordable Care Act is probably the single biggest transformative factor driving changes in healthcare in probably the last 50 years. One of the things that it's doing to promote patient care is, first of all, expand the access to affordable health insurance. All the students, all the professionals at UNE, one of the hardest things they're going to deal with is taking care of someone who is uninsured. Because when you do that, you have to weigh decisions. What do I want to do therapeutically for this patient? And how will someone pay for this out of pocket if they're uninsured? How do we complete the therapeutic relationship in a way that leaves someone whole at the end of the encounter?
My name is Libby Cummings. My position at the Portland Community Health Center is called Outreach and Enrollment Specialist, and what that means is that I do community outreach, like presentations to different agencies and different people, as well as the enrollment piece, which means I help people get enrolled in health insurance. And I focus on the programs in the health insurance marketplace.
A big piece of the Affordable Care Act is to provide preventive care, and a lot of individuals, particularly people in their 20s and 30s and 40s, don't get a preventive care because they don't want to pay for it or can't afford to pay for it. So preventive health care is where I see the team coming together much more than I do in acute care.
Increased opportunities for prevention are built into the ACA, which requires that healthcare plans offer a comprehensive package of items and services known as essential health benefits. Essential health benefits include items and services within the following 10 categories: ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance use disorder services including behavioral health treatment, prescription drugs, rehabilitative and habilitative services and devices, laboratory services, preventive and wellness services and chronic disease management, and pediatric services including oral and vision care.
So if you're buying health insurance through the marketplace or through any new health insurance plan, you know it's going to be good insurance. It's going to cover those benefits. It's not going to bottom out on you when you need it most.
Importantly, the ACA, unbeknownst to many people, also includes many other aspects of trying to improve healthcare quality and ideally trying to control healthcare costs as well.
From a consumer point of view, just the practical access to healthcare coverage and therefore to healthcare is an important experience of it. I think people who haven't had that access previously will also start to experience what it means to have a medical home, to have a primary care provider, and will learn over time how to use that medical home to their best advantage.
It'll affect their relationship in part with the providers, because there'll be the providers will have more of an incentive, we feel, through ACA to treat the whole person. A good example of that is the behavioral health homes and integration of care. With now people with mental health problems or behavioral health problems, they can go to the mental health center, but if they're part of a behavioral health home, they'll also get their physical medical care there. So it's a big impact, and could have a big impact on patients from that perspective.
The reason that it's a big step forward is that most of these people ordinarily would wait for a problem to become so severe that they had to go to the emergency room. And if they're in the emergency room, the testing that they would go through there would be very expensive. And then there's a high likelihood they would get admitted to the hospital, and every day in the hospital is extremely expensive. And so the cost to our healthcare system of having the uninsured is actually a big burden.
Also, something like diabetes, these chronic conditions that need to be managed, those conditions don't, hibernate or kind of hang out and wait for you to get medical care. They're around all the time. And so with Americans, who've been here forever, and new Americans, and anybody who's coming into the healthcare system with pent-up need, these chronic conditions really are at the forefront of this sort of scene in healthcare delivery right now. Managing chronic conditions is an important role of the healthcare system, and the Affordable Care Act helps to really create a collaborative environment where it is easier for people to manage those chronic conditions.
The other thing is that patients are only patients when they're sitting in the exam room, and patients are people the rest of the time. And I think the Affordable Care Act begins to put some emphasis on helping providers and healthcare systems think about what's happening in patients' lives outside of that exam room time, and trying to make linkages outside of that so that people think about, or providers think about, people much more holistically.
Please turn your attention now to the members of your team, and using what you already know from your scope of training and what you've learned about the Triple Aim and the 10 essential health benefits, to provide excellent patient-centered, team-driven care for the family featured in the patient case.